My name's Paul. I'll be sort of moderating these breakout sessions today. To begin with, we've got Dr. Pansak. He'll be talking about how balancing your hormones contribute to longevity. I'd ask you to welcome Dr. Pansak to the stage. Thank you.
Thank you and good afternoon, everybody. Do you have a good lunch? Do you feel sleepy? You know, because after a lunch, we have a lot of blood go to our GI system. So it decreases the blood to our brain. There is time for a little bit sleep in the afternoon. And you know that if you have a little bit of the nap after lunchtime, it may increase your lifespan. Why? Because we know that the testosterone hormone, that is the main ingredient of a man. The first wave released at midnight, and it go up a lot at 7 o'clock in the morning. Then it's just going down steadily until lunch, 12. And after that, if you have a nap, it will go in a second wave a little bit. That is the secret of living long. But people will not tell you to do because they just want you to work hard. Understand? Okay? But this is the secret. So today I'm going to talk not the way, sometimes not the way that you think that I'm talk. You know, I'm talk about hormone for the last 40 years. 40 years ago, I talk as a conventional medicine doctor. Talk about over and under. Talk about hyper and hypo. Talk about too much and too low. That is disease oriented. And take care only people who are out of range as diseased person. 20 years ago, we start what we call anti-aging lesson, something like that. So I talk a hormone on the anti-aging biochemical substance, how they will contribute to protect you from aging. But the last 10 years, I talk hormone on the function, on the wellness, how to improve your wellness through optimum hormone. We have to know, previously when we are talking about hormone, you see something like that. Or after age of 35, the lady are not going to get baby easily. You may get a bad baby or blah, 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 because your ovary decline in function and your ovary have been bombarded by all the free radicals so that they're getting old or blah, 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 blah. And now, you know, a lady now, you have to go to see a doctor who are reproductive endocrinologists and say that I just want to leave my egg with you before I can find someone to fertilize it. Okay? Which means that our body declines from time to time. And the first sign is the female fertility going down. And we are going to listen to the second speaker who are going to talk about that. But you see that when they are talking about hormone, they're talking about hormone insufficiency, hormone deficiency, and cause a lot of symptoms out there. How about hormone balance? How about optimum hormone? If we can make the hormone in our body in the optimum level through any kind of lifestyle medicine, anti-aging medicine, wellness medicine, spa medicine, blah, 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 will be good? Good. Okay, so I'm going to talk hormone in another way. For me, hormone is biochemical substance that release from your endocrine gland. When it releases this substance into our bloodstream and go to our target organ and help regulate our target organ to function well. Today we talk about function medicine. So hormone is like a regulator to control the function of every organ. To summarize, we have to know that when hormones start, the cell cycle starts. Cell is the smallest unit in our body. It starts to grow. Growth. So hormone is for growth. When it's growth, it do some metabolism. Okay, it do some function. It get maturation. After function already, that cell have to die. We call that apoptosis. And when apoptosis occur, they have something called phagocytosis to eliminate that out. That the signal sent back to the origin, to the stem cell, to release a new cell to this cell cycle. So with a good level of the hormone, you get birth, growth, function, apoptosis. But if you have low hormone or imbalance of the hormone, or hormone is not working well, just after function, they did not die easily. They get sick before die. That called cell senescence. And people who are in the world know that cell senescence is like cell sick. When the cell gets sick, what do? They try to fight to stay alive. And that one cause that may lead to cancer cell in general. Okay, that decrease your lifelong. By the way, not only that, if the cell gets sick, they get inflammation. And inflammation may cause in the blood vessel or in many areas that we listen already in the morning. That will decrease your lifelong achievement. So with a good hormone balance, it prevents cell senescence. It prevents cell sick. It makes a good cell cycle. And then you have a new cell to replenish the old one. Is that good? Okay. So what is the research? So this first. This is, we use, Okay, they do some research and they found out that the hormone, when it going up all. The first one start is the growth hormone. When it going up, it start going down after age of 25. So when people ask me, at what time start getting old? 25. Who are younger than that? No. Okay, but don't worry. It start aging process, but it didn't mean that we are old. Okay, so after age of 35, the growth hormone drop down more than 20% of maximum. And that start other organ to decline function in production of the hormone, like your adrenal gland. Okay, you know that your adrenal hormone is hormone that make you healthy, a lot of energy, fight every day, stay in your life. And you feel that when you get older, sometimes you do not have a vitality to fight. You tend to get depressed. You tend to live away from the problem. But if you have a good level of the hormone from adrenal gland, you fight everywhere. So that is the way. And then after the adrenal gland hormone going down, later on male hormone going down, later on female going down until what we call menopause. That's why I told you, 40 years ago we talked about menopause and andropause. And when we talk about that, we talk on the illness-oriented. But you know, Global Wellness Institute talk about wellness-oriented, the paradigm shift. So now we have to see hormone in another way. And the research show up that the theory of aging is multiple hormone deficiency, not synchronized and not balanced. Okay, that definitely show out that. And they show that well-dosed and balanced hormone supplement may slow down or stop the progress of senescence and may reverse or kill them. So that is second wave that I told you that 20 years ago we talked about the anti-aging. And the anti-aging deal with bioidentical hormone. We talk that we can replenish your lost hormone by give you the hormone that resemble your own hormone in the body and then work well with a good effect and less bad effect. So that is, we call it anti-aging strategy. And that began 20 years ago. But 10 years before, we talk about wellness. How we can make our body produce good level of hormone to lifestyle medicine, to stress reduction, to mindfulness, to probiotic, or many things that will make us live well in this world. So the words living well, the wellness way come. And how can we achieve that? We have to have a good hormone level. If we can make all the hormone going up and stay over there, it should be good. Okay, it should be good. Then how can we do that? How can we do that? We have to do the integrated way. Not only take bioidentical hormone. You have to have a good wellness exercise. You have to exercise to increase the production of the growth hormone. That's a way to do that. You have to exercise to increase your testosterone production. And also, you may need to do some spa relaxation so that when you are relaxation, all the happy hormone going out. When all the happy hormone going out, you sleep well. And then when you sleep well, we know that most of the anti-aging hormone and longevity hormone produced at night time when we sleep. So if we can change our lifestyle to be all the wellness side and forget the illness, because now we still worry about how to defeat the illness, how to blah, 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 how to prevent. But will it be good if we take care of ourselves so that our body produce enough hormone? That can be done. Okay, something like that. So we do hormone balance for increasing health span, not lifespan. Sometimes when people say longevity is not live long, but with Alzheimer's, stay in bed or have dialysis. We don't want that. We want to walk until the last day of our life and go to sleep and did not wake up again. Do you want that? That is That is the thing that we have to do, and the thing that can help that is our inner energy, that is hormone. So sometimes when I talking about hormone, why need a hormone balance? Why need to talk about deficiency or replacement, blah, blah, blah. Because if you think about hormone, hormone is biochemical substance released into the bloodstream and have a work in our body. It's like the inner energy. So it go along well with the old way of the traditional Chinese medicine that's called qi. Okay, you need a balance of qi. And you are Ayurveda, you have to balance of the chakra. And if Thai style, you have to balance of Vayo. So this come long time, more than 3,000 years. So to balance that, if in the literature of the old way for a long time. Okay, I did not talk much about it because optimum hormone in our body, it have a good effect, everything, and not necessarily to know it's good. Everything is good. Do you think that not good? Okay, but I will talk about the way of the anti-aging. We use bioidentical hormone. And I just want to point out that sometimes when we talk about bioidentical hormone, we think about product. This product is better than that product. We may think now another way, that it is the process. It's the process that we find some substance to boost our hormone from outside. It can be herbal. It can be what we call biochemical, or it can be something that enhances the more production in the body, but need to put at optimum level, not maximum or overdose. Because sometimes when people are going to use hormone, they think it on a kill. They want it to kill, but we not want. We want it to heal. We want it to enhance our body to function well. So if later on, maybe someone need to take bioidentical hormone, let the doctor give you at optimum level. Optimum level is the level of around 35 of age. Okay. With that, it will be good. Okay. In the morning, I just see people talk about the statin. That is one thing that I did not like, because statin block here. Block from cholesterol, not to turn be a good estrogen, not to turn be a good testosterone, not to turn be a good cortisol, not to be good a progesterone. But the thing that I just want to point out is that if you are happy from the cholesterol you take, it will come on this way to DHEA. But you are not happy, it will come on this way to be cortisol. So every day should be a happy day. Every day should be a happy day. If you have a happy day, your body produce a good testosterone, estrogen. And testosterone, everyone know that is the index of longevity. It decreases the mortality. So take good cholesterol. Okay, take good cholesterol and sleep well. Okay. Did not go. Okay, so balancing hormone is very good, and you see that the lowest dose very give is the lowest dose. Why? Because it just want to give very low, not to have a side effect. Okay, just go ahead. And it is safe to be used if you need later. Go next one. Okay. Okay, okay, and hormone therapy if you need. It improves the sexual function, it improves urinary tract infection, it improves many things that make you live long. So that is in menopause. Next, please. Okay, next, please. Next, please. And it's safety, I did not want to bother. And it protects your osteoporosis. Because osteoporosis makes you live short. Okay, next, please. Okay, and it is safe to be used. You see that they just do research, found out it did not relate to breast cancer. If you use bioidentical estrogen, the one that caused breast cancer, because in the first they do research, they use progesterone. They use chemical progesterone. And that chemical progesterone is carcinogenic, not estrogen. So later on, if you are going to use estrogen to prolong your life, anything, use it safely. Next, please. Yeah, next please. But use it as a, what we call, as a cream. Don't put it oral. And this is the one that they use synthetic. Not good. Okay, next please. Okay, next please. Okay, and it's good for your skin. Every lady need a good estrogen. Anyway, next please. Okay, skin aging start, and when skin aging start, you feel not so well, and then you don't want to live long. Okay, so first have a good estrogen and live long and beauty. Next please. Okay, this is one I talk a little bit. When you get older, the testosterone going down production, the sex hormone binding globulin, the printing go up. So the one that are active, free testosterone going down. That's why when people get older, the testosterone going down, and that makes the men moody, depressed, cannot work well, and sometimes fight with his loved one. Because when the men lost male hormone, their logic gone. Okay, and sometimes, because the logic is that men cannot fight with a lady, true? But if the testosterone gone, they did not know that logic, they fight. Okay, next. So if you have a good testosterone, the family will be very happy, right? And you live long. Okay, next. Okay, same back. Okay, this one very classic, just want you to see. When you use testosterone therapy, it makes the survival time going up. Okay, so if we can make ourselves produce a good testosterone by napping a little bit after lunch, okay, it may increase the survival time. Next, please. Okay, next, please. Okay, next, please. I did not want to show that. Okay, and then choose well. Choose well with testosterone. Next, please. Okay, the one that you have to choose is the one with a gel one. It comes to optimum level and stable. Other type of testosterone not stable. Next. Okay, oral is the best one. Next. Okay, what is good? For the testosterone, both men and lady, it increases your bone density, so you live long. Next. It did not increase PSA, as people say that testosterone causes prostate cancer. No. A good level of testosterone may protect prostate cancer and make you live long. Next. Okay. The last but not least, I talk female hormone. I talk a little bit on the growth hormone. I talk a bit on the testosterone. But you know, to have a good optimum and balancing your hormone, you have to live a circadian life. You have to live according to your circadian. When we see the sun, wake up. When the sun gone, sleep. Because at night time, when you sleep well before midnight, the production of the testosterone will start. And that is the cycle that make you live long. Okay, surprisingly, you know that when you sleep well, the androgen production or testosterone product in a good amount, and your muscle is good, it take out your fat away, and then the branching or the logic, and you have energy to go out, work very well all day. Okay, so, and this one, it occurs a lot during this time of the year. People get adrenal fatigue. You don't want to wake up in the morning, and in night time you don't want to sleep. Because in the morning, the level of the DHEA from the adrenal gland, okay, did not high. And in the afternoon, it a little bit lower. And that make you worry, and you cannot go to sleep. Okay, this is the magic that I do for all my patients who cannot sleep. Just give a melatonin, a short-acting one and a long-acting one together, 2 hours before go to sleep. Okay, so you can go to sleep and maintain sleep. That's a trick for the doctor to do. And melatonin is safe to be used because it is a substance. It is a supplement. If you cannot sleep well, try to use melatonin. But you have to use 2 hours before time of sleep, not eat it as a sleeping pill. Okay, okay, and then something like that may help balance your hormone. Because of the short time, so I just stop at this one, but told you that. Try to find to live a circadian living, and all the hormone balance will occur, and you will live long, definitely. Thank you.
Thank you, Dr. Pansak. I don't know about you, but I got from that sleep is important for testosterone and just to live a long life. So melatonin can help with that, I guess. Thank you. We'll now have a Dr. Lanelle Dunn. She's a naturopathic and an anthroposophical physician from Dubai. She's going to be speaking on functional medicine approach to fertility. If you'd like to welcome to the stage Lanelle Dunn. Thank you.
Can everybody hear me okay? Great. Okay. Well, thank you for inviting me here. It's beautiful to be in Bangkok. It's been a few years since I've been here, so it's nice to travel again. I'm not a fertility expert, but in the last 6 months, I've partnered with a big fertility group in Dubai and have shifted into a little bit more fertility. So I just want to share a little bit more of an awareness. The general population, I realized only later, is mostly my age. So nobody's really interested in fertility once you get to 50. However, I think functional medicine in general, if we look at functional medicine already at the beginning stage, at the oocyte and sperm, you can actually prevent health issues in the next generation. So let's go. I think everybody knows what integrative medicine is, so I don't have to kind of stay here. But what I will say about this is over the last 20 to 25 years, what I found and what functional medicine has done for me is it's given us much more evidence-based in natural medicine. So, you know, we used to talk about leaky brain and leaky gut. And in the last 10 years, we actually now have diagnostic tests for LPS, for zonulin levels. And so now we're finally proving it with the help of a lot more evidence-based research. So I think it's really important to combine both practices. So from a fertility perspective, what we're looking at is really 3 main biological processes. We also look at the gut and the vaginal microbiome. We look at, of course, nutritional biofactors, because those are all the cofactors for your biochemistry. We're also looking at stress levels, mental, emotional health, and obviously other lifestyle factors that are affecting fertility issues. And this is probably the anthroposophical physician hat I'm wearing right now. But I think even in functional medicine, we forget how the nervous system works sometimes, in that the nervous system really is taking all of your thoughts and feelings and belief systems and is actually having neurological reactions which create peptides, which create your biochemistry for all of your cell function. And so we really have to have a new lens when we look at anything functionally, but also from a fertility perspective. And we all have to look at what's going on in the thinking and feeling of the human, just as much as diet, just as much as environmental toxins and environmental load, etc. And everybody's showing this today. It's from the IFM website, Institute of Functional Medicine in the US. And again, it's just to reiterate that every time we have a disbalance or disease, it's actually because of many factors, including what we put into our bodies, how many nutrients we are deficient in or we take into our bodies, the quality of air and water we take in, how much we move our bodies, how much we meditate, how we view our life, how we feel purposeful or we're always in stress and always thinking we're not enough. I think I got most of them all. Yeah. So when all of those things play into factors from your nervous system, and then things like how your cells transport nutrients, how you eliminate toxins out of the body, how oxygen is being transported. All of these things are making an impact, which then make an impact on neurotransmitter formation, hormone formation, how you digest your food, etc. So finally, at the end, when there's enough disbalance, finally we're seeing clinical signs and symptoms. So you can see why everybody has been talking about so far today that conventional medicine is missing a very large piece of actually what's going on. And this is no different in fertility as well. And I say this time and time again because I often am teaching fertility in conventional doctors. I gave a lecture a couple months ago to 200 IVF specialists, and they just want numbers. They're very focused on numbers, and they don't understand why a functional doctor can't change an AMH in 2 weeks. It actually takes a little bit longer. So the 3 processes we'll focus on: oxidative stress, inflammation, and methylation pathways. So I'm talking about chronic inflammation just to make things clear. Chronic inflammation is usually induced by pathogens, can be from trauma, but it depends on your SNP. So it depends on your genetic variants, how well you detoxify, how well you methylate, what's your predisposition to oxidative stress. And there's also some inflammatory SNPs that we also look at. But depending on these factors depends on how much burden your cells actually acquire from chronic inflammation. When you do have chronic inflammation, it's a hormone, puts a lot of emphasis and extra burden on your endocrine function, and naturally fertility declines. What we see in the clinics and all the IVF centers that we have is it's definitely associated with recurrent implantation failure and spontaneous miscarriage. And one thing I would also like to say is that in general, we're coming out of a pandemic, but in my career over the last 20 years, what I really would say is that the pandemic, it really is not COVID, it's really about inflammation and separation. People have kind of forgotten what it means to be human. We don't go out in nature. I don't know, whoever lives in Bangkok, how often do you go to a park? How often do you go to the sea? How often do you go to the jungle here? All of those things make you very human. And I think in the last couple decades, people have kind of gotten further and further away, and inflammation certainly has gone higher and higher. So one thing a little bit more interesting about inflammation is we look at cytokines in 2 processes. So cytokines are divided up into Th1 and Th2 processes. Th1 processes, those cytokines are much more pro-inflammatory, trying to get rid of invaders. The second one are much more into differentiation and proliferation of cells. And in fertility, we actually need both, and we need a balanced ratio. What happens a lot of the time with endometriosis, with recurrent implantation, is that we have a much higher lean towards Th1. And what we're seeing a lot in Dubai is interleukin 18 and 6 elevation. And I've recently associated them with mycotoxins. And we're very humid, like you are in Thailand. And I would imagine you have the same problem with mold, but I don't know if anybody tests mold here, but mycotoxin illness is a huge issue in Dubai. I think it's one of the biggest culprits for chronic inflammation, even more so than viruses, because if you have mycotoxins and viruses, usually it's the mycotoxin that is making the virus stay activated. What else can I say about that? I think so, that's probably enough. Oxidative stress. I guess the other thing I would say is that when you have a lot of chronic inflammation over time, your mitochondria function becomes less and less. Biotoxin illness, for instance, mold, it actually really is like a wet blanket on the electron transport chain in the mitochondria. And so it really slows down ATP production and increases overall your oxidative stress. Hopefully, most of us remember about oxidative stress and free radicals. We need them. Oxygen-bound molecules with extra electrons to make them unstable, so we can produce oxidation if there's an invader and we need to oxidate something quickly. So it can be very beneficial. But at the same time nowadays, because we're so subjected to so many toxins, and poor nutrients and diet, what happens is your antioxidant balance is generally lower than your free radicals, and you end up with a lot of extra oxidative stress. And we know that oxidative stress increases mitochondrial mutations, DNA fragments, DNA sperm. It damages the electron transport chain, increases permeability to the cells, and decreases the mitochondrial defense systems. And I don't know if anybody remembers, but the oocyte has the highest amount of mitochondria per cell. It's at least 100,000. We don't know, it could be even up to 500,000 mitochondria per oocyte, whereas the sperm only has 25. And so it's always kind of the female's job to do most of the work. But oxidative stress is really important in fertility because if the oocyte's job is to differentiate, become a blastocyst, and eventually become a healthy embryo, and we have mitochondrial dysfunction, it impairs everything from the very beginning stages all the way to, thanks for the time, all the way up to blastocyst dividing and embryo development. This is one journal article saying half of all infertile men have oxidative stress, but I think that's a very low number. I would say that what we see in the clinics is at least 80% of all guys with male factor fertility have increased mitochondrial function issues. Okay, so this is just all the data. Methylation. Methylation has been in the functional realm for probably last 10, 15 years. I used to treat a lot of autism, and about 15 or so years ago, I started noticing that every autistic child I had an MTHFR SNP. And certainly in the last 5 years, it's becoming increasingly more common with fertility patients. So to make a long story short, because I know I'm already running out of time, MTHFR is a driving pathway. I always think of it as a driver for other biological pathways in the body. It helps to make neurotransmitters, hormones, detoxification pathways in your liver. So if you're a poor methylator, all of the other biological reactions are coming less. And this is probably too much information, but what I will say is about 60% in the US have an MTHFR SNP, which means lower and lower methylation, in general, lower and lower efficiency in the general biochemistry. So decreases CoQ10, glutathione, melatonin, serotonin, nitric oxide, norepinephrine, epinephrine, carnitine, cysteine, and taurine. And the research shows that we know that 677 is the most common one. We see it a lot with women. It's the one I generally focus on testing so far because it has the most research, but definitely associated with low AMH and recurrent implantation failure. 129 has also got a bit of research around unsuccessful IVF. And in the last 3 months, I've discovered a new one. If you know what MTHFR is, you might not have heard of this one yet. It's G179. It was actually found to be protective for men, but for women, once again, we always have to do a little bit more work. And it was shown to have lower follicles and less estrogen levels and more unlikely attempts with IVF. These are a lot of the SNPs we're testing for. And then I guess the most important part is the integration and the treatment plan, but these are all the factors which hopefully everybody already knows. Obesity, food here, lots of fat, lots of carbs, lots of sugar, low nutrient dense food, low fiber, low good fats, like the last lecture said, good fats make hormones. Not moving enough. Smoking is interesting. Cadmium is the highest heavy metal with the highest binding affinity to the calcium receptors in the electron transport chain. So out of all the heavy metals, it's the one that's the very worst at decreasing the electron transportation and stopping, inhibiting part of the ATP production. Chronic viral, bacterial, and parasitic infections, and the biggest one, I think, actually, that we're focusing at the minute is mold exposures and mycotoxins. I can't not mention something about gut health. What we see often is people who have dysbiosis and they have too much Clostridium or a form of E. coli. It actually makes beta-glucuronidase, and this enzyme, it actually cleaves estrogen. So we're already living in an estrogen-dominant society because of our environment, our toxins, our plastics, groundwater in most Western countries have too much estradiol. And so the problem with that is we already have too much estrogen as a generality, but then if you have dysbiosis in your gut, you end up recycling it over and over again, which slows down your liver, and it just increases fertility issues. Again, fried foods, overall meat consumption, and not enough fiber. Probiotics most commonly researched and associated with fertility are Lactobacillus rhamnosus and reuteri. And one study showed that vegetarian women had half recycled estrogen comparative to carnivores. Okay, so treatment plan, we do an integrative model. I got 5 minutes left, so I'm just wrapping up. We use clinical nutrition. We do a nutritional analysis with every patient. Natural medicines with us may be anything to do with intravenous herbs, Western and Chinese herbs, supplements, diet. I have a fertility diet that it took me about 3 months to do the research on. It's generally lots of vegetables, but it's anti-inflammatory, high methylating food, high polyphenols to activate sirtuins, high methylating foods. Genomic counseling, we do a lot of SNP testing. And I can't emphasize the last one, mindfulness. Look, by the time people come to see me, they've already done 3 or 4 rounds of IVF and had no attempts. So these women and couples generally are very deflated, they're depressed, they feel like they're broken, like something isn't right with them. And they were already stressed, or else this would never have happened in the first place. So this is a huge part of our practice. And I looked up the fertility issues in Asia, and I just want to say last night, and Asia has the highest amount of infertility on the planet right now. I don't know what it's like in Thailand, but 1 in 4 to 6 couples have fertility issues, and I think it's increasing, and it's because of the burden and because we just work too much, I think, and don't eat and take care of ourselves. With continued research and evidence-based modalities, we can combine age-old traditional techniques with the newest advances in technology and functional medicine. And last but not least, integrative fertility is the future of the next generation. Now, if we get people in before they're even thinking about conception, and we just work on them to make sure they're in a more optimal space, imagine how their kids are going to be when they are born. The health of the baby is definitely a lot better. Thanks very much. I made it.
Thank you, Dr. Dunn. We're just going to just wait a few minutes before the next speaker. Our next speaker is Dr. Jimmy. He'll be talking on hormone therapy and sexual medicine. He's one of our doctors here in Miskowan. I'm just being told that the other group is about 2 minutes away, like the changeover. If people want to go to the other group, they're still running. So we'll just sit tight for 2 minutes and then we'll get started. we might get started. Dr. Jimmy is one of our doctors at Miskawan Health. He'll be speaking today on the topic of hormone therapy and sexual medicine. Welcome, Dr. Jimmy.
All right, Sutthipoj. You can call me Dr. Jimmy. So today is a pleasure for me to talk about hormonal detoxification. So let's get started. All right. So before you talk to your patient, you have to get all the information from your patient as much as possible. First, your diet. Ask your patient how much they eat per day, nutrition, how much protein, carbohydrate, and fat they consume. Are they vegan or not? Because it's very important. Address about their lifestyle, exercise. Are they doing, how many hours of exercise they do per week? And how many of you doing 150 minutes per week in this room? None? Wow, okay. Oh yeah, it's a puppy life, very good. Address adrenal and thyroid. So for me, I would say like before you talk about sex hormone, adrenal hormone is much more important than the sex hormone. Adrenal is always the first hormone. The second one is thyroid. And the last one is the sex hormone. So always start with adrenal, thyroid, and sex hormone. Address about blood sugar levels. Okay, Ajahn Patana talked about that in the morning already. Methylation and sulfation, I will talk more in phase 2 of detoxification. And last one, of course, is the gut health. So I do have a lot of patients come to my clinic and they have so many different types of signs and symptoms, including menopausal symptoms and anopausal symptoms. Menopausal symptoms such as mood swing, depression, weight gain, osteoporosis. For guys, erectile dysfunction, they take more time to recover from their muscle for weightlifting, okay? They don't feel that strength, that power anymore, okay? Or I do have patients as well, come to the clinic, Dr. Jimmy, I don't have any symptom, but I feel old from inside. Even though they look good on their face, maybe they did some surgery or fillers or Botox, but internally, they feel old, they don't feel that energy anymore. So that is another question that the doctor have to treat them. Again, another pictures of cholesterol cascade or steroidogenic pathway. So everything starts from cholesterol, right? Ajahn Pansak already mentioned that our sex hormone starts from good cholesterol. So I always measure my patient cholesterol levels should be around 150. If it's lower than that, obviously you have to look what are they eating. Are they on low fat diet? Are they on statin medication? So make sure that they have good level of cholesterol, at least 150, okay? So mainly today, I will talk about the sex hormone, estrogen and testosterone detoxification. Now, for detoxification, it happened in 3 phases, phase 1, phase 2, phase 3. I didn't put phase 3 here, I'll talk about it later. So everything in our body, our food, vitamin, minerals, toxin, antibiotics, even hormone, it's a fat-soluble compound. It has to pass to your liver first for phase 1, and it gets converted by cytochrome P450 by hydroxylation reaction. After phase 1 reaction, most of the fat-soluble toxin will get converted into activated intermediates. Now, activated intermediate, you don't want them lying around your body because they are very active, they're very toxin to your body. So you need to convert the intermediate compound to phase 2 right away, okay? So phase 2 reaction mostly is conjugation. There are so many reactions happen in phase 2, and then the intermediate will get converted into water-soluble compound. So what happened after it turned into water-soluble compound? It will get excreted, okay? Now, excretion in our body, it will go 2 ways. The first one, the water-soluble, will go to our blood, excrete out to your kidney as your urine. The second way, it will bounce to the bowel, go to your intestine, and pass out as your stool. So for estrogen metabolism, the detoxification, 2 phases. Phase 1 is involved with cytochrome P450 and 5, 1B1, 3A4, and 1A1. And phase 2 reaction, there are so many reactions, but the one that I'm going to talk about is methylation and glutathione conjugation. Why? Because all this enzyme in phase 1 and in phase 2 reaction, you can taste it. You can check from your patient urine, okay? So for hormone, you can check in 3 ways: blood, urine, and saliva, okay? As Ajahn Pansak mentioned before, you need good sex hormone for your lifespan, for your health span, right? But the thing is, how do you know that the sex hormone that you have in your body, are they good or bad sex hormone, okay? They are bad or can cause cancer in your body as well, all right? So phase 1 detoxification. So most of the estrogen, estradiol, will get converted into E1. There are 3 different types of estrogen in our body: E1, E2, and E3, okay? And everything will get converted into E1. Now, E1 in the liver for phase 1 can be converted into 3 forms: 2, 16, and 4. 2 is the good, 16 is the bad, 4 is the worst, okay? So you want to have a good enzyme 1A, CYP1A1 to upregulate your 2-hydroxy-E1. So that is the protective estrogen. 16 is in the middle, is pretty bad. You know, you don't want to have high enzyme level of 3A4, but 4-hydroxy-E1 is the worst because it's pro-carcinogenic. Very active. You want to move them, you want to clear them out from your body as fast as possible. And 4-hydroxy-E1 can get converted into 3,4-quinone, which is very toxin, very carcinogenic, okay? Can you stop it? Yes, you can. From 3,4-quinone, it can convert back to 4-hydroxy-E1 again by the enzyme called quinone reductase. Now, once you get to 4 and 16-hydroxy-E1, you want to convert them as quick as possible to phase 2 reaction. So how could you do that? Obviously, you need a lot of methylation pathway to get the intermediate compound get into phase 2 reaction. Of course, your detoxification has to be good, and sulfation, which will be happen in phase 2 reaction. So I stopped talking about phase 1 already. Now it's the phase 2. There are so many reactions in phase 2: sulfation, methylation, amino acid conjugation, and glutathione conjugation. Phase 2, your liver need a lot of nutrient, especially amino acid like arginine, glutamine, glycine, methionine, taurine. Those are very important to help with the detoxification. So after you pass from, now we are in phase 2, right? 2-hydroxy-E1 will get converted into 2-methoxy-E1. So that is protective by the enzyme called COMT of the methylation pathway. 16-hydroxy-E1 will get converted into estradiol. And 4, the worst, estrone, will get converted into 4-methoxy-E1 by the enzyme called COMT, okay? What about 3,4-quinone? So that is another reaction. You can change 3,4-quinone into neutralized substance by glutathione transferase. What about phase 3? So phase 3 is your gut health, okay? There's an estrogen microbiome in your gut. So very important that you have to talk to your patient. Do they have any symptoms of their gut health, constipation, indigestion, diarrhea? Have they been taking any antibiotics in the past? What about their diet? Are they drinking alcohol? Are they taking any probiotics, prebiotics? Okay, so imagine phase 1, phase 2, and phase 3. It's your body, right? And phase, you have like, your liver is your bathtub, okay? Phase 1 is the water filling inside your bathtub. Phase 2 is the drain. Phase 3 is the pipe getting out from your house. So basically you want, the water will come to your bathtub everywhere 24 hours. You cannot stop that, okay? Phase 2 is the drain. You have to make sure that the drain is open. There's nothing blocking the drain. That is phase 2. And phase 3 is the pipeline, getting out the water from your body. So I start talk about phase 1, phase 2, and phase 3. But when you address your patient, you have to always start from phase 3 first, back to phase 2, and go to phase 1. You don't want the water to get blocked from the pipeline and it will get overflow to your house, right? To your bathtub. Okay, so start from phase 3, 2, and 1. What about guys? For guys, they do have exactly the same enzyme like women. 1B1, 1A1 aromatase, which changes testosterone into estradiol. 5-alpha reductase change testosterone into dihydrotestosterone, which is 5 more times more potent than the testosterone. And of course, the COMT. Can we block the aromatase enzyme? Yes, we can. There's a lot of supplements, herbs that can help to block the aromatase enzyme, for guys. What about other things? Like, if you start treated your patient already from phase 1, phase 2, or phase 3, or any state, you can start treating your patient all 3 phases at the same time as well. But what if there's nothing better after you treat your patient for a few months? You have to look something else. You have to think outside the box. Look at the toxin, the heavy metals. In Thailand, we do everyone, like almost 90%, we have like aluminum intoxication, the PM 2.5, our food, pesticide, insecticides as well, the sleeping disorder, the insulin, the sugar levels, okay? Look at the DHEA and pregnenolone levels, the alcohol, paraben, and everything else, like from your shampoo, from your perfume as well, okay? Find other toxin, and then actually you can test them out to your blood and your urine. So overall, the treatment, obviously you have to decrease the exposure from all the toxicant to your body, address the nutrition, okay? Eat more fibers, more nutrient, okay? You have to get at least, I would say, 30 to 50 grams of fiber every day to support your gut. Personalized supplements, very important. Lifestyle modification. For my patient, I will ask them about their lifestyle for everyone, and they should change their lifestyle. Don't depend just on the doctors. We cannot help them forever. As Kun David mentioned, that you are your own best doctor, right? Sleep and mind, body, spirit, very important. These are some supplements that I recommend for increasing glutathione transferase in phase 2 reaction, which can change the 3-fold quinone into neutralized compound, less carcinogenic. NAC, one of the best. Vitamin C, vitamin E, miltrisol, silymarin, garlic oil, fish oil, melatonin. You can take like 3 to 5 milligrams before your bedtime, and antioxidants, herbs, turmeric is one of the best. And methylation pathway is happening in phase 2 reaction as well. So for methylation, we start from COMT. You need SAM-E, methionine. We give out the methyl group to support the methylation, and other supplements such as vitamin B2, B6, B12, magnesium, methionine, TMG, and reduce coffee and alcohol consumption. So that's it for today. I hope you have a better understanding of phase 1, phase 2, and phase 3 of detoxification. And once again, I'm Dr. Jimmy. Thanks for your attention.
Thanks, Dr. Jimmy. We're going to take a short break for 20 minutes. You're free to take a walk outside or go to the other room. We've got some sponsors with their tables outside if you'd like to have a look at those. But we'll be back in here in 20 minutes' time. Dr. Andy Schillinger will be speaking on the heat versus ice for soft tissue healing.
Visionary Healthcare.
Did you know that alcohol-based hand sanitizer is only effective for 2 minutes after you use it? Sanitizing your hands every 2 minutes would be impractical. Introducing Isengard 24's Persistent Hand Cream Sanitizer. Persistent Hand Cream Sanitizer is an all-natural, moisturizing hand cream that effectively sanitizes the hands for long-lasting protection after a single use. It's like wearing an invisible glove that keeps you protected against germs all day. Protect your hands today.
โตแน่ใจนะว่าสุขภาพดีกว่าแม่ชัวร์ยังไม่พอต้องชัวร์จากในนี้ด้วย
ไวต้าชัวร์เครื่องดื่มนมแพะมีโปรตีนแคลเซียมสูงมี 2C กรดไขมันดีย่อยและดูดซึมง่ายช่วยลดโอกาสการสะสมของคอเลสเตอรอลนมแพะคุณภาพเสริมการใส่ใจตัวเองไวต้าชัวร์
Time waiver information field technology. Analysis on the deepest level. Pinpointed, precise, made in Germany. You want to look behind the scenes, understand the connections, see the invisible? We would very much like to help you. Time waiver, your connection to the information field.
เนื้องอกหรือมะเร็งเกิดจากหลายเหตุปัจจัยมีทั้งปัจจัยภายในและภายนอกที่ RV Lab เรานำเทคโนโลยีการตรวจวัดตัวบ่งชี้ในแมคโครฟาจจากประเทศเยอรมนีเพื่อตรวจระดับตัวบ่งชี้อะโปเทนและ TKTL1 ช่วยประเมินความเสี่ยงการเกิดเนื้องอกหรือมะเร็งในร่างกายมากกว่า50ชนิดทำให้สามารถตรวจเจอได้ตั้งแต่ระยะก่อตัวควรเริ่มตรวจหาการก่อตัวตั้งแต่วันนี้ด้วยความปรารถนาดีจาก RV Lab
Visionary Healthcare.
Did you know that alcohol-based hand sanitizer is only effective for 2 minutes after you use it? Sanitizing your hands every 2 minutes would be impractical. Introducing Isengard 24's Persistent Hand Cream Sanitizer. Persistent Hand Cream Sanitizer is an all-natural, moisturizing hand cream that effectively sanitizes the hands for long-lasting protection after a single use. It's like wearing an invisible glove that keeps you protected against germs all day. Protect your hands today.
โตแน่ใจนะว่าสุขภาพดีกว่าแม่ชัวร์ยังไม่พอต้องชัวร์จากในนี้ด้วย
ไวต้าชัวร์เครื่องดื่มนมแพะมีโปรตีนแคลเซียมสูงมีทูซีกรดไขมันดีย่อยและดูดซึมง่ายช่วยลดโอกาสการสะสมของคอเลสเตอรอลนมแพะคุณภาพเสริมการใส่ใจตัวเองไวต้าชัวร์
Time waiver information field technology. Analysis on the deepest level. Pinpointed, precise, made in Germany. You want to look behind the scenes, understand the connections, see the invisible? We would very much like to help you. Time waiver, your connection to the information field.
เนื้องอกหรือมะเร็งเกิดจากหลายเหตุปัจจัยมีทั้งปัจจัยภายในและภายนอกที่ RV Lab เรานำเทคโนโลยีการตรวจวัดตัวบ่งชี้ในแมคโครฟาจจากประเทศเยอรมนีเพื่อตรวจระดับตัวบ่งชี้อะโปเทนและ TKTL1 ช่วยประเมินความเสี่ยงการเกิดเนื้องอกหรือมะเร็งในร่างกายมากกว่า50ชนิดทำให้สามารถตรวจเจอได้ตั้งแต่ระยะก่อตัวควรเริ่มตรวจหาการก่อตัวตั้งแต่วันนี้ด้วยความปรารถนาดีจาก RV Lab
Visionary Healthcare.
Did you know that alcohol-based hand sanitizer is only effective for 2 minutes after you use it? Sanitizing your hands every 2 minutes would be impractical. Introducing Isengard 24's Persistent Hand Cream Sanitizer. Persistent Hand Cream Sanitizer is an all-natural, moisturizing hand cream that effectively sanitizes the hands for long-lasting protection after a single use. It's like wearing an invisible glove that keeps you protected against germs all day. Protect your hands today.
โตแน่ใจนะว่าสุขภาพดีกว่าแม่ชัวร์ยังไม่พอต้องชัวร์จากในนี้ด้วย
ไวต้าชัวร์เครื่องดื่มนมแพะมีโปรตีนแคลเซียมสูงมี 2C กรดไขมันดีย่อยและดูดซึมง่ายช่วยลดโอกาสการสะสมของคอเลสเตอรอลนมแพะคุณภาพเสริมการใส่ใจตัวเองไวต้าชัวร์
Time waiver information field technology. Analysis on the deepest level. Pinpointed, precise, made in Germany. You want to look behind the scenes, understand the connections, see the invisible? We would very much like to help you. Time waiver, your connection to the information field.
เนื้องอกหรือมะเร็งเกิดจากหลายเหตุปัจจัยมีทั้งปัจจัยภายในและภายนอกที่ RV Lab เรานำเทคโนโลยีการตรวจวัดตัวบ่งชี้ในแมคโครฟาจจากประเทศเยอรมนีเพื่อตรวจระดับตัวบ่งชี้อะโปเทนและ TKTL1 ช่วยประเมินความเสี่ยงการเกิดเนื้องอกหรือมะเร็งในร่างกายมากกว่า50ชนิดทำให้สามารถตรวจเจอได้ตั้งแต่ระยะก่อตัวควรเริ่มตรวจหาการก่อตัวตั้งแต่วันนี้ด้วยความปรารถนาดีจาก RV Lab
Visionary Healthcare.
Did you know that alcohol-based hand sanitizer is only effective for 2 minutes after you use it? Sanitizing your hands every 2 minutes would be impractical. Introducing Isengard 24's Persistent Hand Cream Sanitizer. Persistent Hand Cream Sanitizer is an all-natural, moisturizing hand cream that effectively sanitizes the hands for long-lasting protection after a single use. It's like wearing an invisible glove that keeps you protected against germs all day. Protect your hands today.
โตแน่ใจนะว่าสุขภาพดีกว่าแม่ชัวร์ยังไม่พอต้องชัวร์จากในนี้ด้วย
ไวต้าชัวร์เครื่องดื่มนมแพะมีโปรตีนแคลเซียมสูงมี 2C กรดไขมันดีย่อยและดูดซึมง่ายช่วยลดโอกาสการสะสมของคอเลสเตอรอลนมแพะคุณภาพเสริมการใส่ใจตัวเองไวต้าชัวร์
Time waiver information field technology. Analysis on the deepest level. Pinpointed, precise, made in Germany. You want to look behind the scenes, understand the connections, see the invisible? We would very much like to help you. Time waiver, your connection to the information field.
เนื้องอกหรือมะเร็งเกิดจากหลายเหตุปัจจัยมีทั้งปัจจัยภายในและภายนอกที่ RV Lab เรานำเทคโนโลยีการตรวจวัดตัวบ่งชี้ในแมคโครฟาจจากประเทศเยอรมนีเพื่อตรวจระดับตัวบ่งชี้อะโปเทนและ TKTL1 ช่วยประเมินความเสี่ยงการเกิดเนื้องอกหรือมะเร็งในร่างกายมากกว่า50ชนิดทำให้สามารถตรวจเจอได้ตั้งแต่ระยะก่อตัวควรเริ่มตรวจหาการก่อตัวตั้งแต่วันนี้ด้วยความปรารถนาดีจาก RV Lab
I think we'll get started. We've got a talk now with Dr. Andy Schillinger. He's going to give us a talk on heat versus ice for soft tissue healing. Andy is a good friend of mine, and he's with our Miskawan Health Group as our rehabilitation expert. So please welcome Andy to the stage.
Oh, sorry. I just twisted my ankle, and maybe can someone bring ice? Ice is very important, you know. That's what is everybody doing in the whole world. Someone falls down, and the reaction is directly, oh, can someone bring ice? So it must be right. If the whole world is doing this, we should also do it. I broke the machine. This bottle. Oh. Okay. Perfect. Yeah, I'm not the best with all these technical things. Yeah, just a little bit about my person. I'm a doctor of physical therapy and did my master in sports physiotherapy and rehabilitation. And I work as a lecturer, researcher, and most of my life I worked in professional football, in Bundesliga and for the Thai national team. So I've seen thousands of soft tissue injuries, kicks, twisted ankles, muscle ruptures. And the question is always, what can we do to bring the people back as fast as possible? We call this rehabilitation, and rehabilitation means to support the natural healing process. We heard already a lot about that the body is your best doctor. So actually the body knows how to react to an injury and what to do to heal it. So we should support this and not work against it. That's a very important message. We have to create an environment to support the healing process. We have to treat the problem and not just the symptoms. And it should be individual and customized. Inflammation. I'm talking here about an acute inflammation. And inflammation has 5 signs, already written by Galen at around 150 after Christ. So we know this already a long time. It's always heat, redness, swelling, pain, and loss of function. This is a normal reaction of the body, and it's part of the healing process. There is no healing without inflammation, but there is inflammation without healing. We heard this many times that people have pain, they have inflammation, and after a while people say, oh, now you have a chronic inflammation. Most of the time people say, oh, we have to stop the inflammation. But like I said, the inflammation is a normal part of the healing process. Dr. Gabe Merkin wrote already in 1978 the RICE method for injuries. I think most people heard about it. It's rest, ice, compression, and elevation. Until now, most people follow this, especially the ice. That's when it really started with, oh, we need ice, apply ice. But the question is this really the right way to do it? 25,000 sprained ankles a day. And if we look at the research, around 30% of these people have, after the use of rest and ice, still pain after 1 year. So it seems to be that rest and ice is not the right treatment. More and more doctors, therapists say, oh, we have to start moving as soon as possible. But still they are using ice. Ice, people use it for injuries, for pain, and after surgeries, and sometimes for weeks. There are hospitals, rehabilitation hospitals, where they put everyday ice on the injured area. And if I speak to therapists, they make physiotherapy, they make exercises, and directly after, they put ice. And I say, why you do this? Yeah, that it's not getting big after and that it will not hurt after. So first they want to move, and when I move, I increase the metabolism. I have more blood flow, and after they put ice again to bring everything down. Actually, it doesn't make sense. The physiological effects of ice. It decreases the inflammation. So it puts the inflammation down. I mentioned already, we need the inflammation to have a healing. Because of the inflammation, the body can start the healing process. If I have an injury, there is a lot of damaged cells, waste products, blood, and the body has to remove it. That's the first step. And then later, the body has to rebuild the structure again. All this cannot happen without the inflammation and with a good metabolism. But when I put ice, my blood flow goes down. So I always explain it like this. If we have a house and the earthquake comes, everything is damaged and there's a lot of waste. If you now want to rebuild the house, what do you have to do first? You have to remove everything what is damaged. For that, you need macrophages. And these cells will help to remove it, and we need the lymphatic system. The lymphatic system is our cleaning system in the body. If we put ice, the macrophages will not go there. The lymphatic system cannot remove everything, so I don't have this cleaning process. The next step is to build everything up again. The blood vessels have to bring new material, proteins mostly, to build again the muscle or the structure which is damaged. So it starts with collagen type 3, and then the body will change it to type 1 or 2. This all depends on a very good metabolism, on a blood flow. If I put ice, I stop this healing process. Vasoconstriction, so the blood vessels go down, they close. We have a decrease of histamine reaction. It produces swelling. Produce swelling? I thought ice will reduce swelling. Everybody tell me if I have swelling, put ice. Because everybody tells me the ice will reduce the swelling. No, it's not true. Ice will produce swelling. I will show later some more research about this. It will decrease the immune system, but actually we need an immune system, a good immune system, to become healthy again for the repair process. It will decrease the pain. This is very good. Yeah? Of course, when I put ice, I don't feel the pain anymore. So people treat the symptom. But actually, it's negative for the healing process. And the pain is also a warning signal. So if I put ice, and I don't feel the pain anymore, I will maybe use it too much and then make more damage than I had even before. It reduced tissue tension and muscle spasm. There is some research about ice and swelling, and on injured people, already Lewis in 39, and then you can see all these research papers show exactly that ice is not reducing the swelling. So there is more than enough evidence for this. Van Wingerden, or Weingarten, he's a professor from Belgium, and he was the first one who woke me up and said, Andy, don't use ice anymore. So I'm still thankful about this. Even on healthy people, they made research, and also there, they had the same effect. There is no positive effects and no reduction of swelling. Moisen showed that there are negative effects on the lymphatic system after applying ice. And I said already before, the lymphatic system is our cleaning system. Yeah? When someone gets injured, we see the hematoma, and sometimes we don't see it on the first day, only swelling. On the second day, we see that it's getting blue, because the blood from deep inside comes from the lymphatic system on the outside, superficial, and then it will be removed. Dr. Ursula just had this experience. She had an injury on her knee. She came to see me. There was big swelling. We made lymphatic drainage. The next day, she came again, and we could see it was blue, but the swelling was reduced. And she didn't put ice. So this and the damage of the small vessels of the lymphatic system is one reason for the swelling when I use ice. The application of ice also can destroy the tissue and the body reaction, and can create inflammation, which makes the edema. Yeah? Especially with ice spray, what we see very often in sports. Takachi made a very nice research in 2010. So he put directly after the injury 20 minutes ice and had a control group. Of course, he had to do this on the muscle of rats. Difficult to do such a research on humans. And he checked the cell activity, growth factor, and macrophages. This is the no ice group, ice group. And if we see here, we have a lot of macrophages. Here we have less macrophages. So this is responsible for cleaning up. After 3 days, we see regenerating muscle cells present, and here we have a reduced muscle cell number. After 4 days, we have normal-sized muscle cell produced. Here, it's smaller. After 14 days, we have a normal maturation of the regenerating muscle fibers. And here, it was reduced. And the cross-sectional area of the regenerating muscle was 65% greater than the icing group. And, very important, the collagen fibers were seen only among the bundles of muscle fibers, like in healthy muscles. But if we look at the ice group, there was abnormal collagen formation. And this shows that the healing factor is very bad. The new tissue, the quality, is not like it should be. And then we get chronic problems. Then we get re-injuries. And we get a prolonged healing process. These findings suggest that icing applied soon after injury not considerably retarded muscle regeneration, but also induced impairment of muscle regeneration along with excessive collagen deposition. So we have a slower rehabilitation and the quality is not as good. That's not what we want. And if you just think about the physiology, it's clear what is happening if we don't have a good metabolism. Takeuchi made in 2013 actually the same research but with heat. And the regeneration of the muscles was better and the collagen deposition was also much better, so the quality of the new muscle was better. And the selectivity. So we need to increase the metabolism. If we look at the latest research, this is just from the last years, Sakamoto just published a systematic review where he showed at all the research, and here also Kawashima with ice and heat in 21. They all come to the same result. Ice delays the start of the healing, lengthens the recovery process, has a bad tissue quality, and impairs muscle regeneration. Heat supports the healing process, increases the metabolism, better tissue quality, facilitates the regenerative process. Many people say, I don't like ice. I love ice, if I can eat it. If we just look at the research, everything is clear. In the beginning, when I tried it in professional football, the coaches, the players were, no, you cannot put heat. You have to put ice. And I was, no, trust me, let's do it. The next day they come and they say, Andy, I feel much better. We had a player who needed a knee surgery, and I spoke with the doctor who did the surgery, and I asked him, can you please not put ice after the surgery? And he said, we do this always. We do the surgery, directly ice. And I said, please don't do it. Let me know when the surgery is finished, and I come 1 hour later, and I start manual lymphatic drainage to activate the lymphatic system. And he asked why. I explained to him, and he said, okay, let's try it. So I did the lymphatic drainage, no ice. The next morning, I did again lymphatic drainage. We put heat on the knee. A few hours later, the doctor came to check, and he said, okay, let's open the bandage. And he opened it, and he said to me, Andy, there's nearly no swelling. Why? We didn't put ice. And then he said to the player, oh, can you bend? And he bent. And he said, wow. At the end, it was the same like always. He said, wow, that would be good if we change our procedure. He talked to other doctors, and they said, no, we always use ice. We continue like this. And this is everywhere. It's the same in Germany, in Thailand. I was invited to Qatar, to the Espetar Rehabilitation Center, the best rehabilitation center in the world. And I spoke to a group of doctors from all the Champions League teams in football. And we asked them, are you still using ice? And they said, yes. And I asked, why? Yeah, the president, the players, the coach, everybody wants it. And they said, yeah, but you are the doctor, you are the therapist, you must decide what is the best treatment. And this is a big conflict we have many, many times, yeah? So we all worked here in professional football, and many times we are forced to do things which we don't want to do. And when I talk about this, especially the young therapists come to me and say, I understand it, I want to do it, but they don't let me do it. Change always needs time. And in March 2014, Dr. Gabe Merkin the guy who started the RISE protocol. Coaches have used my RISE guideline for decades, but now it appears that both ice and complete rest may delay healing instead of helping. If he can change, everybody can change. And if we just think about the physiology, I think it's very, very clear what our body needs, and we must support the healing process of our body. Thank you so much, and I don't know if we have time for questions, but yeah, I hope you enjoyed it. Thank you.
Sorry? I don't think so. We've got to probably move on. Yeah, I'd like to.
So please, if you have any questions, come to me. I will try to answer. We have one?
We have time?
You directly raised your hand. You have a question?
So I'm just curious, all the cold plunge pools and ice baths that we put into our wellness centres, are they a waste of time?
Yeah, like what I like to say is always it depends. Yeah, when I worked in professional football in Germany, we had a big pool for recovery, and it was hot, 38 degrees. And then later it came, especially from American football, that they started using ice. They started it because they had contusions over their whole body and they had pain. So they went inside to reduce the pain. But for the healing, it's not good, especially if we go too long. If I would go inside maybe for 10 seconds, 15 seconds, I would have the effect of reducing the pain. But if I go out after 10, 15 seconds, I have this reactive hyperemia, so the blood vessels close and directly open again, so it would not be negative for the healing process. But if we look at the research, there's no evidence that this long ice bath for 2-3 minutes is positive for healing or for recovery. Yeah? Okay, I get the sign. Sorry, we have to stop, but yeah, if you have any questions, please come. Thank you.
Thanks, Andy. That was very informative. I won't be using ice anymore. Thanks. Okay, next up we've got Dr. Chrsitopher Jensen. He'll be talking on the topic of Healthspaning, a quest for a longer life. If you could welcome Dr. Jensen to the stage. Thank you.
So again, good afternoon. It's lovely to see all of you here. And again, as I said this morning, it's my honor to be here, to be able to speak to you about something that's very personal to me, but I think also very much a trend, but also very personal and should be very personal to all of us, because this is the future. This is what the future of medicine, I think, will look like, and it impacts everybody in this room, and impact all of your families, everybody. So I want this to be interactive at the end. I hope there'll be a little bit of time for people to ask a few questions. So an important question to ask you all is how many people want to live a long life? More importantly, how many people actually want to live a healthier life? Because the healthier life is the last part of your life. And the last part of your life now, many times, is lived in a state of unhealthiness, with lots of doctors and nurses prodding and doing lots of unnecessary things to us, which we could essentially prevent. So you see at the top there, in the last century, we've actually almost doubled the lifespan. So in 1920, the average life expectancy in the developed world was anywhere from about let's say 50 to 56 years, and today it's over 80. The number of adults over 65 is expected to be greater than the number of children by the year 2060. The questions that we want to ask today are, what's pushing the healthy aging envelope, and how do we push it further? How do we keep people healthier longer? and how and why we can live healthier and longer lives. That's the question. That's the big question that we're going to try and answer a little bit of today. Essentially what you hear from Dr. Sinclair, and you're going to hear from me, and I hope you're all going to think about this now, is that aging is a disease. We can treat aging as if it's a disease. And conditions once thought to be inevitable consequence of aging aren't a consequence of aging. We can prevent them. So if we're talking about root cause, again, we're going back to what I said earlier. The root cause of aging are these diseases, right? And there are a few axioms of how. They're simple to follow, and they're enormous gains of lifespan and health span. They come together in the daily habits that we live, the way we sleep, the way we eat, the way we exercise, how mindful we are, where we live. And these are essentially the habits that we have in our daily lives. How we breathe is even important. How we get up in the morning, how we breathe, how we move around, what our social constructs are, what are the people around us, how much love do we have in our lives, how are the people that are in our lives impacting us and loving us, and how are we loving them back. Prevention strategies coupled with the incredible advances in medicine and in technology and in science are changing the world. They're going to change the way we live our lives. This is the disease conundrum. This is what we've been talking about. In today's typical life, you look at the green chart up there at the top. Do I have a pointer here? Do I have a pointer on this? Is that this thing? This one? This one. Okay. Ooh. So if you look at if you look here, and you look at what this age category, we live to about 60. We start to get health issues, then we get sick and we die. The 20-year goal is that we're going to get to about 100. We're going to have issues at around 100. We're going to get sick and we're going to die. And at this point, the issues that we're going to die of are going to be much, much fewer. So we're probably going to die in our sleep, and we're not going to have any disease. That's the goal. So again, by 65, most of us in the developed world, about 60% of us will have one chronic disease. 42% of us will have 2 chronic diseases. And these numbers of elderly and diseases will just increase due to bad habits and bad medicine, and mostly reactive, not proactive, not preventative medicine. And this is a humanitarian crisis. This is a health crisis, this is a humanitarian crisis, this is an economic crisis. And if we don't confront it, we're going to be in big, big trouble. So the big 3 ones, Alzheimer's, cardiovascular disease, and osteoporosis, and there's lots of little things that are intertwined in there, are ones that can be prevented. We can prevent them just by the way we live, the way we eat, the way we move, the way we live our lives. So in this, it's a little bit confusing, but you can see here in an unhealthy lifestyle, these are physical activity, poor diet, smoking, and alcohol abuse, all implicated in what we see are heightened biometrics, high blood pressure, high cholesterol, high fasting blood sugar, obesity, and being overweight, then going on to these medical conditions, the big ones, diabetes, cardiovascular disease, cancer, COPD, and non-communicable diseases, all leading to death, okay? And this basically just gives you the risk factors and how it proceeds. So this, I'm going to get into a little bit of what we call the age slowing strategy. So what we need to do to confront this problem is we need to slow how fast we age. If we slow how fast we age, we can prevent the diseases and we can slow the aging process. And we're getting to a point now where we can actually do that. All of this, what you're hearing and what you read and what you see on television is real. So 20 to 30% of how long we live, and we've heard about this from lots of my colleagues today, is dictated by genes. But the rest is multifactorial. It's how we live. It's epigenetics. And where you live, and how you live, what you eat, how you eat it, how it's sourced, how much pesticide is on it, how much you exercise, and if you start exercising today, it's going to be good for you. And ultimately what your weight is, not smoking, reducing your alcohol, not taking drugs, reducing your stress. Stress is the silent killer. Stress is killing us slowly, but we need to figure out a way to mediate stress. So anything that we can do to mediate stress is has an enormous effect on our lives. Sleeping well, I didn't mention, but sleeping is also very important. When we're young, the physiologic response that we have to change is rapid. But as we get older, it simply gets longer. So these are some of the things that happen as we get older, and these are damage, these are all the things that happen that we talk about that lead to cancers, right? Response to damage, altered regulation. What happens as we get older is we can't get back to baseline. So we have a response, but we can't get back to baseline. And the late manifestation of that in aging is that we get frail and ultimately we die. So when we get frail, we fall over. And as we fall over, the more times we fall over, the more predictive it is of mortality within a period of 2 years. So it increases your mortality exponentially each time you fall. So if we can prevent people from falling, and if you look at lots of parks in China where I've lived, and you see people practicing Tai Chi in the morning, that's the reason they're practicing Tai Chi, so that they can remain strong and steady for longer periods of their lives. So we should also all be practicing Tai Chi. So again, going back to this chart that I talked about before, 25 to 30% is heredity, 75% is epigenetics. Talk about the genes, the mutations, and in the environment, the errors that occur, the actual process that occurs when those things happen here. We then have impairment of damage removal systems, homeostasis disorder, where we're not homeostasis, we're not homeostatic, meaning that we're not in sync. We have a decreased adaptive capacity of the body to deal with that. We age as a consequence. We get age-related diseases in the latter part of our lives, and ultimately we die. All of this we can slow down. The upper limit of age and how this will change. Right now we think that the upper limit of age is anywhere from between 115 to 120 years, but we feel that that will change. That with the science and the technology will get longer and longer. So over time, if we don't get killed by cancer, CVD, cardiovascular disease, or a bus, our ability to confront complex metabolic and structural systems after disruption decreases over time. So we'll have an upper limit. And as we age, our blood counts, as an example, and when we get a CBC, our blood count will take longer to get back to baseline, as will our step counts, the number of steps that we take during one day. It will take longer to get to baseline, and that will allow the blood counts and the gait not to return to normal as quickly. And as a consequence, we call this human resilience. The resilience, therefore, is in decline, thus leading to death. Over time, we hope that that resilience will be strengthened by us preventing disease. We want to live a more we want to live a longer and more importantly, a healthier life. And we want to slow down the rate of aging. That will be the most important thing we can do, because that's going to stop a lot of the disease processes. And we're going to increase our productive life as a consequence. This is what we call productive longevity, which is the biggest economic opportunity in the 21st century, as will allow humanity to continue to serve those in need for much longer. We also want to live longer to see our loved ones, our children, our grandchildren, our friends. And again, I go back to that very important thing that we were talking about, is about love and having love in your life and having a good social construct around you. And it's predicted that the current 3 stages of education, education, career, and retirement, will be replaced by something else, because we'll be living longer. I'm on my second and now third career. So these are the big things that have happened in the last 10 years. And this is the reason it's so exciting to be a scientist or a doctor and be involved in life at this point, is because these things are just taking off. So you've got robotic surgery, you've got CRISPR, you've got the Horvath methylation clocks and methylation clocks I'll talk about. The hallmarks of aging were discovered, which are a bunch of pathways that we can look at. Senolytics, deep aging clocks, AI, which is a huge one, which informs a lot of the ways we can make decisions around how we live our lives. Big medical data, the UK Biobank contributing enormous amounts of information to what we can do. Clinical trials of multiple constructs that we've looked at. The advent of telemedicine, metformin. It goes on and on. But these, down here at the bottom, the understandings that we're having now in genomics, transcriptomics, proteomics, metabolomics, it's a revolution in what's happening. And this is what's informing a lot of what you're hearing about from my colleagues today. So I'm very optimistic, as I think you can hear, and I hope you can hear it, because the future is bright. Even though we've just come through a pandemic and we're having difficulties, we have a war, we have potentially a food problem. Once we get through that, and we hope we will, the future is bright. And it's informed by medicine and science making these enormous advances. The advances in AI and machine learning alone are making these incredible things possible for us in medicine. Genomics and proteomics are coming of age. The aging clocks, where we can look at making longitudinal personalized medical choices for our patients and understanding their personalized risks and being able to appropriate treatment that's personalized to them, which is a lot of what my colleagues are doing. Gerontology or biogerontology, where it's giving us an understanding of huge advances in understanding the age conundrum and why we age and how it works. And then how do we monitor all of this? How do we look at it? How do we inform each other? How do we look at how we treat diseases as they go on, or healthy people? And one of the big ways is through this revolution in wearables and monitoring of people in real time. And that's expanding in an enormous way. So the modern medicine of today, this is what we call modern medicine, is reactive. Aging is normal physiological condition that doesn't require any condition, and the fight against manifestations of a particular age or dependent pathologies, and the extension or quality of lifespan instead of the quality, the extension of quantity versus the extension of quality, which leads obviously to frailty and old age and death. The medicine of the future is proactive. It's where we take medicine as the consequence of us is taking care of ourselves and being consistent with what we want for ourselves. As David said earlier, it's very important that we, doctors and all of us, our body is our temple. Take care of yourself, monitor yourself, go and get yourself checked out, make sure that you're preventing illness. So these are some of the areas that will help to slow aging: gene therapy, genome protectors you'll hear about, data-driven individualized anticipation and diagnostics, data-driven therapy, which again goes back to the personalization of medicine, regenerative medicine, which is a lot of what we're talking about, diet and how we use diet, and the new advent of coming to a meatless world, which we will probably be in the next 20, 30 years. We'll be eating a lot less meat, and you can already see that in a lot of the industries. And then physical and mental stress management. I can't underscore how important this one is. So the future age medicine prescription might include, these are some of the pathways. It would be a whole nother talk for us to talk about this, but in mice and in some humans, they're already starting to use this, where we're looking at specific pathways that have been identified in science, mainly by people like Dr. Sinclair. But there's mTOR, MK, the sirtuins, and a lot of what we're talking about here are things that we can do now to restore that. So we can put increase NAD by either putting it in infusion. We can eliminate senescent cells with specific types of what we call senolytics. We can use young plasma or umbilical cord cells. Of course, all of this I'm not saying that we're promoting it today, but this is where the evidence is moving. This is a little bit about what happens as we retain stem cells as we age, because stem cells are essentially undifferentiated cells, and they're capable of self-renewal. But as we get older, that becomes more difficult, and the number of stem cells may not significantly decrease with age, but the regenerative potential of those stem cells is reduced. So stem cell senescence, in other words, old age of stem cells, contributes to a lot of the old age related conditions. And I'm going to make this personal at the end. I don't know if you're going to be able to turn that on. Can I turn that on? This is the reason that I live, and this is the reason that I think we all want to live. These are my two kids on Sunday of last week, and I want to be alive as long as I possibly can be for them. Now, if we just stop for a second for the next one, the next slide is also rather personal, because it talks about what you can do at the outer edge of your life. If you eat right, you sleep right, you think right, you move right, you can honestly live a lot longer, and you can be productive a lot longer. So this is a man. You may have seen him before. He's a cardiac surgeon. He's from California, the United States. He lived until 2018 when he died at almost 106 years of age. He was practicing cardiac surgery until he was 95, and I'd like you to just hear his words.
He's lived 100 years and up until 5 years ago was still working as a heart surgeon. But don't ask Dr. Ellsworth Wareham for his wisdom.
I don't know about any wisdom. People associate age with wisdom, and I think that that's probably unscientific.
But what is scientific and backed up by multiple studies is that the lifestyle Dr. Wareham has lived is part of a prescription for a long and healthy life.
Well, I can only describe what I do myself. I must say my family doesn't necessarily subscribe to the program that I'm on. I have never cared for animal products, so with me it was a very easy thing to become a vegan. It just so happens that veganism is a healthy lifestyle.
Dr. Wareham and his 86-year-old wife Barbara both still drive, and Dr. Wareham makes it a point to climb up and down his stairs several times a day for exercise. He worked at Loma Linda Medical Center about an hour east of Los Angeles for most of his career, and he's operated on hundreds, if not thousands, of hearts. His heart is just fine, he says, and so is the rest of his 100-year-old body.
We can stop. I put up a quote from Oliver Wendell Holmes. I don't know if you know who he is. He's a jurist and an incredible theologian from America. And he basically said, through our great fortune in our youth, our hearts were touched with fire. It was given to us to learn at the outset that life is a profound and passionate thing. So I ask you to all think about that, and of course, ask any questions that you have with the remaining time, and please be interactive about your questions. It's a very quiet audience.
You had mentioned quality of produce and pesticides and all of that. That's something that I'm kind of trying to discover here in Thailand. How do you know the quality or gauge the quality when, you know, there's only so much that you can really have control over or understand, I guess, to a certain extent?
It's a very good question. And having lived in China, where you get a lot of the water that's running over and you get a lot of the rain that is actually polluted, it's extremely, really difficult to control. But there are areas in Thailand where they're really doing the best that they can to not to remove all the pesticides, obviously from what's grown, and the areas are never sprayed, and you just have to trust that what's going to fall from the rain, especially if they're away from the cities, is going to be healthy. But looking for organic produce and sourcing that out is something I talked about in my talk, and that's something that we should all learn. We should all learn, because that's a big problem, is where it comes from and how it's sourced and how it's brought to us. Because if it's brought in a big truck and it's brought down to Chiang Mai, to where I am in Phuket, it doesn't make a lot of sense. And that's where a lot of the produce, unfortunately, is coming from. If we have time.
Yeah. I've noticed a theme throughout the talks this morning and this afternoon about stress and work, and how reducing stress, which could be caused by work, reduces the possibility of an early death. What happens if, perhaps like myself, you are the kind of person who, when they sit and do not very much, is actually an unhappy person, whereas when I'm actually working and applying my energy to something that I can get my head around, I actually feel happy and an awful lot better.
It's very interesting that you speak of this, because I worked on a product that looked at stress on a watch, and it's very interesting that when I looked at my stress response on that watch, as soon as I was down and I was looking at my books and I was looking at my screen, my stress response went way down. So stress is not necessarily mediated by how much you work. It's the quality of your work, and it's how you feel about your work. If you love what you're doing and you're in the zone, what I call the zone, your stress response, if you actually look at cortisol, you'd see that your cortisol levels were low. And that's why people who live longer in life and who are productive longer in life are going to live and have less stress than more stress. It's people that live very difficult, stressful, and very stressful environments that obviously that does affect them. So if you don't love what you do, very, very difficult. If you do love what you do, I think it's very different. But again, it comes down to the people that surround you and the amount of support that you have by the people that work with you. I don't know whether anybody saw this, but Goldman Sachs, I never thought I would see this. I'm a former investment banker. I went back to medical school. This is my second career. Goldman Sachs decided in its infinite wisdom to allow its managing directors and its partners to have unlimited holiday. Unlimited holiday. It's amazing. An investment bank saying that to its employees. But they're basically saying, and this is to their top brass, but they're saying, we value you, and we know that you're stressed, and we know that you're burned out. We know this is a condition, and that if we don't sort it out, we're going to have a problem long term. So they're doing their best to do that. Thank you again.
Thank you, Dr. Jensen.
So next up, we've got Dr. Richard Fong. He's going to be talking, he's from the NanoCM company, and he's going to be talking about how genetics and genomics have enhanced precision diagnostics, integrative medicine, and functional medicine.
Yep, is that a mic?
Do you want to use that?
Yep.
Do you have that?
And I presume this is a left and right. Okay, yep, cheers. Thanks to the Dr. Jensen earlier, because most of my talks is going to base on how actually our life is going to be affected by a lot of these factors. Apparently, I'm going to talk about general how, as an educational way, okay, how to increase awareness and how actually the genomics and the One Health is going to help on functional medicines. And if you go into the healthcare, you know everywhere you will have a lot. Oh, it's the key statistics, and we are looking at trillion-dollar industries. And then you've got a lot of integrative medicines, functional medicines, lifestyle medicines, holistic approach, all this kind of terminology. Are they confusing to you? It confused to me. So what we're trying to do is that we have a conventional medicines, and since morning, everyone is talking about conventional medicines and how we should move forward to functional medicines, and where we use a holistic approach to measure the mind, body, and soul. This is where it becomes trying to reduce on the pharmaceuticals levels that you eat a lot of medicines, and trying to offset it with herbals, alternative medicines, and approach to actually heal someone. So this is where the, since it in the morning, someone said, functional medicine trees. You can see that the reason here, we want to find the root causes. Myself is a sufferer as well. I got metabolic disease, and I got a lot of these eczemas, been on steroids, and this. Okay, my problem is I have issues, but how do I solve it? Does conventional medicines help me in my weight ballooning up and down? And then how do we actually solve? And now we're moving towards the new centuries and new medicines, and how we actually address your mind, body, and soul in actually to strengthen up how we actually being treated, and actually, and a view of how we're being treated. So you can see that functional medicines, I don't want to go into too much jargons. Everyone know what is functional medicines. But then we have integrative medicines now, where you are specific being treated, same mind, body, and soul, but to a specific individual to tailor out your personalized treatments. And this is what they call integrative, so that you integrative with your clients. So this is another new term, but they are kind of similar to functional medicines. Then you got your total wellness, integrations of financials, your socials, and your spirituals, occupations, your physical levels, your intellectuals, environmental, emotional. All these things we know, holistic wellness. It comprises of functional, integrative, and most of the terms that to treat the current illness now, which is why this symposium is here. So you have a lot of all these technical jargons. So you got precision medicines, holistic medicines, integrative medicines, functional medicines, lifestyle medicines, alternative medicines. If I'm not the medical practitioners, myself is a medical professions and also a scientist that providing me a unique role to understand between both worlds of treating patients and also doing laboratory works. A lot of my clients saying that, what medicine am I going to approach? Even I have difficulty explaining all this to them. So, what am I going to do? Same, we go biohacking in a One Health approach. So this is where a lot of terms, why don't we combine all this kind of a functional, integrative, all these kind of approaches into One Health. So when we look into One Health, so we'll be looking into how our body, which is being treated, and we are aging, we are suffering, and how the modern medicine is going to treat us. But at the same time, we are looking at the environmental too. But since in the morning, I didn't see anyone talk about on our food source and the animals. So One Health is actually combining all your environment, your medicines, which is for humans purposes, and the foods. Are you aware that our food, are you aware that the meat that you eat, the seafood that you eat, how many antibiotics is being put into the industry? Swine flu is affecting in Thailand, huge. Are you aware the pigs that we eat, how many injections they take every month? Are these not ending up in your body and causes a serious effect too? So when we're trying to look into functional medicines, we are trying to make sure that everything is integratable, that we are trying to solve in a sustainable way. If you have a top-class treatment center, Koh Samui, Panga, all these things, top-class medicine practitioner, solving the issues and how to treat particular patients. But if you go outside, do you notice how many pollution is in there? So, and then you are telling me that you want to solve the root causes. Yes, we solve the root causes for our human. We are not exercising, unhealthy, and all those stuff. But what about our environment? What about our food? Are we going to solve that as well? So this is my reason here to come. How do we actually integrate all this and are seeking cooperations from everyone? How do we move into this One Health approach, where a lot of peoples are going to be cooperations into all these kind of models, how we can promote our long life, like what Dr. Chrsitopher Jensen said earlier. So if you look at that, hey, what is the animal is going to be doing here? You have a long life, projection by Dr. Chrsitopher Jensen earlier, but where is the COVID coming from? Does it not from animal to humans? So this is the thing, and where is the come? Because we close communications, or we eat something that we shouldn't eat, which is happening a lot there in weird places, but nonetheless, this is where you have SARS-CoV-2. So if you look at that, we have to combine also communicable and non-communicable disease and how we actually trying to solve it. So this is where I'm trying to increase the particularly awareness of everyone and seeking help. How do we actually integrate 3 parts systems? It's not easy. So it involves heaps of sectors, disciplines, government blockage. Society need to play their role into a coordinations and a capacity buildings. So we share the whole thing, our planet and our ecology, but we are ignoring some other facts as well. So this is the reason I want to push. If we want to do one functional health, we should do everything together by integrating with our other partners, how we should push for sustainable development goal. And one of that is to key factors on number 3, clause 3 in United Nations, SDG listed, how do we live longer? And this is where we come a particular role. My expertise, myself, is an infectious disease specialist, also a medical practitioner, and got a PhD in genetics and genomics. So this is where I come across multiple approach of omics, and this is where a lot people are using omics now. You can see since 1990 all the way to 2003 on the particular site, Human Genome published. And you can see the sequencing cost of that particular of the data. You can see is is reducing now. So from like hundreds of $3 billion to sequence human genome back then, now it costs than 1,000 USD to sequence your genome. So in genome, it provides a precision diagnostics. I'm into the diagnostic field and how actually the diagnostic field can further and provide or empower the clinicians to do their precision medicines. So my role here is to push using DNA sequencing technology, which is I'm in this field for the past 22 years. How do we actually moving? You can see since like the 80s, now we have 3rd generation sequencer that I am working closely with the UK Oxford Nanopore to provide a POCT device on the next to bed patients to diagnose particularly infectious disease like mycobacterium, which is drug resistance, which is a serious case down in the tropical countries. So if you look into further, so multi-omics, like we've been listening to a lot, we can't just combine just on genomics. Genomics is just the first layer that we understand how our genes and genes regulations, expressions, how it works. But then if you go down to the other stuff, including environments, you go into epigenomics, then you go to the RNA stuff, transcriptomics, proteomics, metabolomics, microbiomics, to give you a whole integrations of personalized medicines, including cancer treatments. So what we can do is, latest trend, we found out that fluxomics. So fluxomics is a new term that we integrate all these things, that how each particular system integrate in the complex pathway on how our metabolics works, and giving you off signals in and off. So this is where I'm trying to emphasize, if we are trying to go into the futures on medicines, genomics can provide you a very useful tool, how we actually provide a precision diagnostics. When we in the precision diagnostics, we can be better to treat our particular patients and giving empowered the clinicians so much more information that we do not know previously. So this is one of the research partners down in Australian National Universities that I work closely with. So they are going into on-call omics now, so which is same as the cancer panel earlier that use a lot of this kind of a genomics works, and how we actually from mutations, gene expressions, your environmental factors is causing DNA methylation into all these kind of SNP variants, and combine it into with the AI and MI machines and learn it to produce your pan cancer, which is other classifications of your cancer, and also modeling your subtype and your drug response to give you a multi-omics fingerprints that all the big data control that can predict. So this is where I come into the bigger pictures and telling you that how actually if we go into One Health and into the genomics, currently how do we do it? We're developing biomarkers from the particularly animal sites, environmentals, and also the humans. In total, now we have like up to like, I think 259 biomarkers. How does this actually causes issues in the humans? Environmental biomarkers like excessive bacteria, viruses, and then some of the antibiotics, heavy metals, and all those things. And then also that how actually the animals, are they infected with certain disease? So we're talking like HPV, but then we're talking like a lot of coronavirus, SARS-CoV-2. So a lot of all these kind of mutations can cause, that can be transferred to human. And we combine also infectious disease in how we're monitoring a particular infectious disease that is possible to actually cause cancer, like HPV and then HIV too. So all these kind of things, if we then combine together under One Health and push it with the precision diagnostics through sort of like using this kind of approach, we can then better tell our situations, what is going to happen in the next 5-10 years. So if we want to live longer, obviously we need to count into other factors, particularly on environmental external factors combined with our internal factors, how then we can better improve ourselves to live longer. I think just 5 minutes they're telling me. So I'm leaving that 5 minutes for particularly interactions. If you have any questions, do let me know. So this is what I put on the last slides on the impact of the climate change. So we have a climate change COPD 26 to meet, and this is a kind of issues into our human health as well, because we don't get access to adequate food and then clean water and other resources. I have to apologize to everyone because my talk is a bit different because I don't talk how my genomics do a lot of clinical settings, because I'm trying to give a different approach and view how that as a medical scientist and also the doctors itself, how we can change our perspective in a different way by giving you a different kind of approach when I talk. So this is my key role today. I'm educational people, and also I'm trying to doing a lot of educational exchange. So by giving a lot of awareness in Thailand. So yep, I welcome any questions. Thank you for that.
I guess there are no questions. Okay, well, we're going to, that's the sort of wraps it up for today. We're going to move out to the main ballroom for a cocktail hour now. So you can do that in your own time. Thanks very much. I hope you enjoyed the talks here today. And have a good weekend.
Visionary Healthcare.
Did you know that alcohol-based hand sanitizer is only effective for 2 minutes after you use it? Sanitizing your hands every 2 minutes would be impractical. Introducing Isengard 24's Persistent Hand Cream Sanitizer. Persistent Hand Cream Sanitizer is an all-natural, moisturizing hand cream that effectively sanitizes the hands for long-lasting protection after a single use. It's like wearing an invisible glove that keeps you protected against germs all day. Protect your hands today.
โตแน่ใจนะว่าสุขภาพดีกว่าแม่ชัวร์ยังไม่พอต้องชัวร์จากในนี้ด้วย
ไวต้าชัวร์เครื่องดื่มนมแพะมีโปรตีนแคลเซียมสูงมี 2C กรดไขมันดีย่อยและดูดซึมง่ายช่วยลดโอกาสการสะสมของคอเลสเตอรอลนมแพะคุณภาพเสริมการใส่ใจตัวเองไวต้าชัวร์